Do you have anxiety, poor stress tolerance, digestive issues, poor immunity? Are you addicted to alcohol? Do you have poor short-term memory, mood swings, even joint pain? Maybe you have also been misdiagnosed with autism, schizophrenia, depression, or anxiety, or ADHD, or you have absolutely no idea what is going on and you're still on the hunt to find out what is happening inside of your body and what is happening to you. You're still looking for a diagnosis, right? Most will struggle with their health throughout their life and never find a long-term answer. And that is why I'm doing today's video, and I'm going to be talking about one of the most common uncommon disorders called pyroluria. Now I'm going to go through what is pyroluria. Let's test you for pyroluria during this podcast, and then what you need to do if you may have pyroluria. Let's get straight into it. It's Mondays with Mahela. That's right, me. Thank you so much for tuning in. I absolutely love, and appreciate your support. For any of you who don't know me, my name is Mahela. I'm a qualified naturopath, absolutely passionate about all things health, business, and overall success. And today, here on Mondays with Mahela, I'm here to provide you with simple, savvy, sustainable health hacks to optimize your health. And this segment is part of the Natural Health Podcast right over here, which you can find on YouTube, Spotify, Apple iTunes, Apple Tunes, whatever podcasts thing you listen to, you will find it on there. Today's topic is such an interesting one. And the reason why I'm going to be talking about pyroluria in specific is because not many people have heard about it. They're like, what is that? But the thing is, the symptoms a lot of people have heard about, and unfortunately a lot of individuals are currently or will be misdiagnosed with a number of conditions when essentially the underlying cause or the underlying issue is pyroluria. So let's get into it. What is pyroluria? That is exactly what I want to sum up right here, right now, right? Originally, pyroluria was known as malvaria, which is quite interesting. So it's been around for a bit, but we're only made aware of it in the recent few years. So it is also known as cryptopyroluria, right? So someone might say pyroluria or cryptopyroluria. It is a chemical imbalance involving an abnormality in hemoglobin synthesis. I know it sounds sciencey, whatever, blah, 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 blah. But what does that mean? Okay, so there are several waste products that occur when your body produces and makes hemoglobin for red blood cells, which is absolutely vital for us to have in our body at any given time, right? So these waste products are called cryptopyroles, which are technically called, stay with me, they're actually called hydroxyhemopylorin 2,1, short for HPL, right? And these are excreted by your body, so removed by your body, right? So individuals with pyroluria are unable to clear the HPL effectively, and they actually build up in the system. So let's make sense of this, right? So what happens is, if you have pyroluria, you have these waste products that are produced by hemoglobin synthesis. So these are the waste products that are produced by hemoglobin synthesis. It happens all the time in our body. Your body is unable to remove it, so it builds up. So there's lots of it here, right? So then what happens? When there's lots of something, it needs to be removed out of our body. But this is what actually happens, right? So these cryptopyroles bind to vitamin B6 and zinc and make these very important nutrients unavailable for psychological and chemical functions in our body. Okay, so we have these zincs. Let's make it simple, right? We have this zinc flying around here, this vitamin B6 flying around here. We have these waste products, and then these waste products, these pyroles, attach themselves to vitamin B6 and zinc, which means this vitamin B6 and zinc is now no longer available for your body to use in so many bodily functions and so many cofactors that it is necessary for. Okay, so you're kind of getting the drill of what it is, right? So these essential nutrients, when bound to the cryptopyluria, are removed from the bloodstream and excreted into your urine as pyroles. Okay, so that is the only way that we're able to remove them from our body, thanks to the zinc, thanks to vitamin B6, attached in the bloodstream and removed out of our body. So we don't want, at the end of the day, our body does not want waste products inside of its body. So that's what it does. It removes them by binding to vitamin B6 and zinc, and it removes out of your body. What means then essentially your body doesn't have the vitamin B6 and zinc that it requires to function at an optimal level, right? So the effect of pyroluria and the deficiency of zinc and B6 can be mild, right? Can be moderate or can be severe depending on the severity of the imbalance, right? So over a period of time, the body becomes very deficient in these critical nutrients and symptoms arise, right? These people will often go years and years and years suffering with the effects of this disorder despite having a healthy diet, healthy supplements, and holistic therapies. So you're one of those people that's like, I'm doing absolutely everything. I'm doing all I can. I'm eating so healthy. Why aren't I okay? Okay, so the effects, like I said, it can be mild, moderate to extreme. It depends when it had started, when it has occurred, and what's happening inside of your body, and how much actual B6 and B6 and zinc you may have in your body, and you have food-wise, right, in your body. Symptoms may include unable to deal with stress. Stress comes to you and you go, I can't deal. Oh my gosh, I can't deal with this, right? Nervousness, that nervous feeling in your belly, the anxiety, the mood swings, like up and down, right? Severe inattention, you're just feeling tension inside. Episodic anger, you just become anger all of a sudden with nothing to be angry about most of the time. Poor short-term memory, you cannot remember things, and maybe even depression, right? Its onset usually occurs during teenage years with traumatic incidents or stress, such as, losing a job, not doing well at school, losing a loved one, or so forth, right? Even though the disorder does not show up until teenage years, it is thought to be genetic. Still research to be done on that, right? Depending on the degree of the disorder, there may be several: depression, schizophrenia, alcoholism, autism, bipolar disorder, also known as manic disorder. On rare occasions, you may have DID, which is dissociative identity disorder, more commonly known as multiple personalities on some individuals, right? These are all different manifestations of pyroluria. It may be different on number of individuals, right? Though it was identified 40 years ago, it's only been recognized as a medical condition as little as 10 years. So many mental health practitioners are not taught about this in university. They don't know about this. Other practitioners, not even just mental health practitioners, other practitioners around there may not know about this, and it is a huge issue out there, right? So people with pyroluria don't respond well to antidepressants, right, such as SSRI, and are often suicidal, unfortunately. So an individual goes to the doctor, says, I'm suicidal, I'm not feeling well, I'm depressed. Doctor puts them on SSRIs and then doesn't work, right? And then they have no other options. They try and eat healthy. They do all these other things. It's not helping them. They don't know what is happening. It may be pyroluria. The sad truth is that most people with pyroluria go undiagnosed. This is why I'm doing this podcast right here, right now, because this may be you, this may be someone maybe your kids, maybe your partner, maybe your cousins, maybe your auntie, someone may have this without knowing. It's all about getting to the bottom of this with a good healthcare practitioner and understanding your body, right? Many mental health practitioners and general practitioners do not think that diet has much to do with these conditions, and therefore pyroluria is not even a condition in their eyes, right? Unfortunately. It is not recognized condition by many mental health practitioners or general practitioners, but the following thing I'm going to talk about right now, I'm going to put it up here, it shows the significance in many mental disorders. How many individuals who have mental health care issues may have pyroluria? Okay. It is estimated that as many as 50% of individuals with autism may have pyroluria. 50% of individuals who have autism. 40% of individuals who have alcoholism may have pyroluria. 70% of individuals that have depression may have pyroluria. 30% of individuals that have ADD and ADHD may have pyroluria. 18 to 20% of individuals may have bipolar, pyroluria. 40% of individuals have schizophrenia, and overall 11% of the population may have pyroluria. These statistics may drop up and down a few percentages depending on which website, which statistics you're looking at, but that's just giving you a rough idea of it is a huge thing. Pyroluria is a huge thing. It is out there and it should be recognized. It's one of the most uncommon disorders, right? So how do you diagnose it, right? How do I know if I have it? How do you know if you have it? What do you do, right? It's actually diagnosed by a simple urine test, which detects the Pyroluria in the urine. Most people who have less than 10 mcgs per deciliter, most people have less than 10, but people who have between 10 and 20 are considered to be borderline pyroluria and can benefit from treatment. People with levels above 20 mcgs per deciliter are considered to have pyroluria, especially if the following emotional and physical characteristics are present, with signs of autism, depression, ADD, ADHD, and other things that are not really spoken about, anxiety, depression, and so forth, right? So this is a test to be done, right? The thing about the test, it is very sensitive. So you need to actually pee in a dark room and cover it in foil because it is light sensitive and needs to be picked up during a certain amount of time of you urinating in the cup and picked up at a certain time to be tested at a certain time. It is a very time sensitive, very light sensitive test. So you need to ensure that you do this with a healthcare professional and they run you through the process. And you need to ensure you do it with the correct lab who's able to go through all of this with you, right? And this test this test can be ordered by a healthcare professional that you're working with. You can't just buy it online and just test it yourself, unfortunately. And if you can, there's probably an issue with it because you need a healthcare professional to interpret these test results for you, right? The thing is also, it may be necessary for you to do a repeat of these tests sometimes to properly determine the number of levels of the KPs that are being excreted because it is so sensitive. So you might have to do 2 or 3 tests to make sure to get an average of it to see if you're, what you're doing is working, it is dropping the numbers and so forth, right? So, I've said to you that I'm going to test you on this podcast to see if you may have pyroluria, right? All right, I haven't done this before on a podcast, but what I'm going to do is I'm going to ask you questions. It's up to you in your mind to answer them yes, no, yes, no, yes, no, right? The questions I'm going to ask you, right? If you answer yes to 15 or more of these, it may be worthwhile testing that you might have pyroluria or the thought of it or work with a healthcare professional, right? This is not a diagnosis. This is just to get an idea. Are you ready? Let's go through these questions. So, write down how many of these you have. This will be really interesting, right? Number 1, little or no dream recall. Number 2, white spots on fingernails. Number 3, poor morning appetite or a tendency to skip breakfast. Number 4, morning nausea. Number 5, pale skin or poor tanning ability or you burn easily in the sun. Number 6, you have sensitivity to bright light. Number 7, you have hypersensitivity to loud noises. Number 8, you have reading difficulties such as maybe dyslexia. Number 9, you have a poor ability to cope with stress. Number 10, mood swings or temper outbursts. Number 11, you have a dramatic tendency. Number 12, you're argumentative. You enjoy arguments. You argue a lot. Number 13, new situations or changes in routine, you find them particularly stressful. Number 14, much higher capability of alertness in the evening compared to the morning. So you're more of a night person compared to a morning person. Number 15, poor short-term memory. Number 16, abdominal body fat distribution. Number 17, you belong to an all-girl family with lookalike sisters. Number 18, dry skin. Number 19, anxiousness. You may be anxious. Number 20, you reached puberty or are reaching puberty later than normal. Number 21, you have difficulty digesting, dislike of protein or a history of being a vegan or vegetarian. Number 22, you have a tendency towards being a loner and or avoiding large groups of people. Number 23, you have stretch marks on your skin. Number 24, you have a poor sense of taste or smell. So when someone goes, oh, did you taste that, smell that? It's a bit poor. Number 25, you feel very uncomfortable with strangers. Number 26, you frequently experience fatigue. Number 27, you have a tendency to overreact to tranquilizers, barbiturates, alcohol, or other drugs. In other words, a little a little produces a powerful response. You take a little bit of it and it really impacts you. Number 28, a tendency towards anemia, iron deficiency. 29, history of mental illnesses or alcoholism in your family. Number 30, easily upset by criticism. Number 31, sweet smell, fruity odor to breath or sweat when ill or stressed. Number 32, you're prone to acne, eczema, or psoriasis. Number 33, you have a tendency towards anxiousness, fearfulness, and carry lifelong inner tension. Number 34, you have a difficulty recalling past events or people. Number 35, you have bouts of depression or nervous exhaustion. Number 36, you're prone to frequent colds or infections. These are some of the questions. Now, if you need to rewind that and repeat that and go through that again, please do. So essentially, this is just kind of like a little, it's not a diagnosis. It is something that assists us to understand if you may have pyroluria. Right? There are a number of these things that come up, and a number of these are zinc and B6 deficiencies that may make you, have stretch marks, for example. That's clearly linked to zinc, right? And so it's interesting, and the other one, prone to frequent colds and infections, linked to zinc. So think about it. How many do you have? Do you have more than 15? Did you answer yes to more than 15? If so, maybe this is something that you need to look at. Investigate with a healthcare professional, with someone that you trust, someone that you love, someone that you trust, believe, and like, that you can connect with, and then they'll be able to work with you to understand if you have pyroluria. And then maybe you can order one of those tests or two of those tests, depending, and see what your levels are like, right? Or your healthcare professional will be able to deal with it, right? So the next question is how to deal with pyroluria. Such a good question, right? I get this all the time. So if I have this, what do I do? Well, number one is actually find out if you have it, right? And that's not you diagnose yourself. That's someone who's able to do that. That's someone that's able to work with you, to understand your history, to understand you as an individual, to understand your body, mind, spirit, to understand that and work with it, right? Number 2, there's diet adjustments that you may be able to do. And number 3, there's supplements that you may be able to add into your lifestyle that may be able to help you with this, right? So pyroluria is actually managed by restoring your vitamin B6 levels and zinc, right? The type of replacement therapy is very important, as zinc must be provided in efficiency absorbed form. So do not go out there to the shops, to the shelf, and just get yourself a zinc or a vitamin B6 because you answered more than 15 of them. No, please don't do that, because it needs to be a specific zinc, specific B6 vitamin given at a specific doses at a specific time. Because, for example, you may be able to have your zinc with coffee. It's not going to get absorbed, right? It's going to hinder it. So these are some of the things that you need to take in consideration and understand. So this is why it's important to talk to a healthcare professional, right? So there are other nutrients which may also assist, such as B3, B5, manganese, vitamin C, and vitamin E that may be able to assist. But people with mild moderate pyroluria usually have a fairly rapid response, right, to treatment if there's no other chemical imbalance or no other health issues at bay, right, or that needs to be taken into consideration. So usually you see improvements between 3 and 12 months, sometimes even if within weeks individual get improvements. I've seen these where individual has taken the treatment provided by the healthcare professional, and wow, they saw a difference within 2 weeks. I'm not saying this is going to happen for everyone. It can take 3 to 12 months for you to see a difference, a change, to feel better, right? Features of pyroluria usually recur within 2 to 4 weeks if the nutritional program is stopped. So if you stop what you're doing, it all comes back, right? So this is why treatment needs to be either ongoing or, depending on your healthcare professional, what they would suggest. Diet is absolutely important, extremely, extremely important. A diet filled with real foods, not the fake junk food, not the fast food, real foods, right? And I'm going to go through, I'm going to give you some, as a bonus, I thought I will give you foods that are high in zinc and foods that are high in vitamin B6. So let's get into it. Foods that are high in zinc, get a pen and paper, write these down. Beef, bilberry, capsicum, egg yolk, ginger, Hernings, liver, oyster, sunflower, and pumpkin seeds, seafood. Absolutely high in zinc. Now, I'm going to go through foods that are high in vitamin B6. Let's go. Avocado, banana, carrot, chicken, egg yolk, legumes, lentils, mackerel, oatmeal, peanuts, salmon, sunflower seeds, and walnuts. So, I don't know if you noticed, but there are some foods that are both high in B6 and zinc, such as sunflower seeds, such as seafood. What else was there? Egg yolk. These are all high in both B6 and zinc. So it's kind of like you're getting a double wham right there, which is absolutely amazing, right? So we've come to the end of this podcast. It was a quick one because there's so much more I can go into detail, but I wanted to give you an overview. This topic can get so complicated, but I wanted to make it simple for you so you're able to, get optimal health in a simple, savvy way. So, as I said at the start, this is one of the most common disorders that individuals may have. So if you or someone you know may have autism, alcohol, depression, ADHD, bipolar, schizophrenia, or even just not being able to respond well to stress, have anxiety, have that nervous tension, that inattention, depression, that may have a poor short-term memory, poor immunity, digestive issues, joint pain, these are all signs and symptoms of pyroluria. Maybe you or someone you know has been misdiagnosed, and the answer is pyroluria. It may be, and I would suggest working with a healthcare professional to find out if this is you or someone you know. So do what you do best. Share this episode with someone that popped into your head that may have this. Share. Do what you do best. Love, like, share, rate, review, subscribe to the Natural Health Podcast, to this YouTube channel, so then you get notified when new amazing content like this comes out. Until next Monday, love you.